Many people find going to hospital stressful, inconvenient and at times frightening. Some patients may prefer to receive the care they need in the comfort of their own home instead. Healthcare at Home's clinical teams do just that, providing personalised care and support for more than 150,000 patients in their own homes every year across the UK. Now, according to the findings of a new report, this type of service could also help reduce the pressure on hospitals while saving the NHS money, as Jonathan Gibson reports.
Hello. Yes.
Good journey.
Jane is a children's home care nurse.
Hi, Jane. Hello. Are you all right?
Yeah.
Today she's come to give Hannah enzyme replacement therapy. Like most children, the last thing Hannah wants to do is spend more time in hospital. And now she doesn't have to.
I prefer at home, definitely. It's just become the norm to me.
Providing high-quality clinical care at home is helping to transform the treatment process for Hannah and patients of all ages with a range of long-term and complex conditions.
Patients really tell us they love a home care service. And when people make choices like that, they take more responsibility for their care as well. And because of that extra ownership, that actually provides a huge boost to their health outcomes. Much less likely for them to go into hospital again and readmit, all saving costs for the NHS.
According to the findings of this new report, providing more clinical care in the home is good for patients and providers and has the potential to save the NHS £120 million a year if adopted by every acute trust. By setting up virtual wards, the NHS in England could save 500,000 overnight stays a year. And most importantly of all, when given the option of receiving treatment at home, the report's authors say it's what patients tell us they want.
Christine Outram is chair of the Christie NHS Foundation Trust, the largest single-site cancer centre in Europe, which is actively pursuing new and innovative models of care to treat patients in their homes. She's also chair of the panel which produced the new report.
Some patients were having, 8-hour return journeys just to get some chemotherapy or some radiotherapy and having to do that quite often. So we certainly were looking for ways of taking the treatment out to patients and relieving the pressure on our resources on the main site. So more recently, we've also implemented some chemotherapy in patients' own homes as well.
Hi, it's open. Come in.
Mary is one of Healthcare at Home's occupational therapists.
I've just come to see you today to assess your environment and how you're managing it. We work to help people transition from hospital back into the community. So we provide that initial support that they need as soon as they get back home.
And the right support means patients can leave hospital much sooner, receiving ongoing clinical care at home.
One of the challenges is with some clinical teams, they worry about having clinical responsibility for patients who are not on their wards and they can't see. So we adjust that in some of our trusts so that the patients actually go back to the care of their GP. But we have a very clear responsibility matrix. And in fact, that one-to-one nursing and care that we give to our patients makes it very safe indeed. If patients do deteriorate, we have very clear escalation pathways back into the hospital.
For frontline nurses like Jane, it's an approach which works.
It doesn't feel scary that I do work autonomously and that I am in a patient's home on my own because I know I have got that support.
We'll keep measuring it, we'll keep monitoring it, we'll keep talking to patients and asking them if they like the service, we'll keep talking to clinicians and we'll say, are you happy with this service? Are you happy delivering this service? And that's the real way forward. It's all about taking positive, proactive action in real-life scenarios.
The challenge now is to scale it up so a service patients say they love can also deliver the financial benefits it promises.